Okay, welcome back. So now we're going to do a care plan on activity intolerance for the same patient, FT, from our Lewis textbook. Um, I chose activity intolerance because it's bothering the patient. It's a patient problem. And it can also apply to a lot of different types of patients. When I looked up activity intolerance in my care planning book, I found that it was on page 122. And so I read the definition, which says insufficient physiological or psychological energy to endure or complete required or desired daily activities. And so I used that to inform my etiology for my PES format of my nursing diagnosis. So number one on this care plan tool that I have here, which you'll recognize because it's part of your clinical paperwork. If you're in one of the RNEX sites and if you're in Amarillo, you'll be able to recognize familiar requirements. So first, uh, I wrote my nursing diagnosis, activity intolerance related to insufficient. Let's edit this to include the word to insufficient physiological energy. And also that kind of comes from the decreased cardiac output from the heart failure. So I did include slash decreased cardiac output as evidenced by patient cannot walk 100 feet without increasing shortness of breath. So I used my patient specific information for the signs and symptoms. Number two here asks for my SMART goals. And so I used my Ackley textbook, and it had some listed client outcomes, and I did follow those, and I made them as measurable as I possibly could. Okay, so it says here, number one, the patient will participate in 100% of prescribed physical activity with appropriate changes in heart rate, blood pressure, and respiratory rate throughout my shift. I didn't decide exactly how many points each of those things could change. I just called them appropriate changes. And then number two, I wrote the patient will state all symptoms. So that's 100%. All symptoms of adverse effects of exercise and report onset of symptoms immediately, 100% of the time throughout my shift. And that's a patient safety issue. We want the patient to be communicating with us what's going on with them so we don't risk having them fall or anything like that. Number three, the patient will be able to ambulate 60 feet without increased shortness of breath during my shift. So those are my SMART goals. And again, I utilized my Ackley textbook to help me get those figured out. The next thing I'm going to do is choose some interventions. And I'm going to use my Ackley book for that. Go ahead and pause the video and write your own nursing interventions. And I'll be back in just a moment. We can look at yours and look at mine. Okay, so I used the textbook and I found some interventions that I really think that I would do for this patient and that would address the patient's activity intolerance. So first, I'm going to monitor and record the patient's ability to tolerate activities such as changes in vital signs, increased use of accessory muscles, and cardiac rhythm. That goes along with my SMART goal, okay? Um, Number two, allow for periods of rest before and after planned exertion periods, such as meals, baths, activities, treatments, and physical activity. And then number three, obtain assistive devices such as bedside commode, walker, and shower chair, and teach patient to use those devices before lunch. So those things should they address my SMART goals, okay? And now I'm going to write some rationale because I need to say, why did I choose those interventions and how do they relate to my SMART goals and my nursing diagnosis? Okay, so I'm going to pause the video and you work on yours and I'll work on mine and we'll come back together. Okay, so I've included some rationale for each of my nursing interventions. I'm going to monitor the patient's status during physical activity because it helps me to know if I need to increase or decrease the physical activity. It helps me to know whether or not the physical activity level is appropriate. Um, and also early intervention in case the patient is starting to have too many adverse effects of the physical activity. I know it while it's happening and I can stop that before the patient ends up getting injured. Number 2, allowing for periods of rest in between activity is going to allow the patient to do more activity throughout the day. If the patient gets physically worn out early in the day, then they won't be able to participate in their own care towards the middle or end of the day. And number 3, assisted devices such as a walker will allow the patient to safely ambulate, because my third goal is that the patient's going to ambulate 60 feet. So I need them to do it safely. Sometimes you'll have to include in your nursing care plan teachings. So I'm going to teach the patient the importance of early identification of the signs and symptoms of adverse effects of physical exertion so he can know what to report. I'm going to teach the patient the importance of continuing to participate in physical activity to decrease adverse effects of immobility. And I'm going to teach the patient the importance and how to properly use assistive devices so the patient can safely participate in physical activity. Okay, so your evaluation. You're going to evaluate your SMART goals. So what I did was I just copy and pasted my SMART goals down in this section so I could be sure that I directly address them properly. So number 1 of my SMART goals was the patient will participate in 100% of prescribed physical activity with appropriate changes in heart rate, yada, yada. So my evaluation, my example evaluation, because I don't know how the patient actually did, was I said that the goal was not met as the patient was unable to participate in about 50% of the prescribed physical activity without inappropriate changes in vital signs specifically. And then I listed out respiratory rate and pulse. So I didn't have to list out the specific ways that the patient had vital signs change, but I really want to do really well on my CPEC. And so I'm going to document that those things. And I could have even said, what the respiratory rate increased to or what the pulse increased to during physical activity. And that really might put me at a 4 in my documentation and care planning portions of the CPEC. The next SMART goal was that the patient will state all symptoms of adverse effects of exercise and report onset of symptoms immediately, 100% of the time throughout my shift. So number 2's evaluation, I wrote that the goal was met as the patient reported adverse physical effects of exercise during all physical activity throughout my shift. The patient was very communicative, I said. So I included a little note that basically gave somebody a really good feel about how the patient and I interacted during the day. And number 3, the SMART goal was the patient will be able to ambulate 60 feet without increased shortness of breath during my shift. And my example evaluation was the goal was not met as the patient only walked 40 feet without increased shortness of breath in the afternoon. What I want you to do is to be honest in your evaluations. It's not bad. There's really nothing bad if your patient is not meeting your goals. All it means is that you might adjust your goals the next time. So if you have any questions on care planning, I just want to encourage you to ask your instructor while you're working on your care plans before you really think you've done something really well and you kind of missed the mark. Go ahead and ask your clinical instructors and ask your local instructors to help you out. And we will do our very best to guide you the best way that we can. Thanks so much. Bye.